In the Central Valley, diabetes rates are some of the highest in the state. But a new pilot program is taking a different approach to treatment, focusing less on doctor visits and more on prevention. In the Central Valley, where diabetes is both common and chronic, community health system doctors and leadership are testing a new strategy.
Diabetes Pilot Program is a population health management program, and it's a program that is designed to help to improve diabetic control for our diabetic patients. And so it leverages resources beyond the physician's office to help patients to achieve better results.
Doctors are facing two big challenges: a shortage of primary care and an overload of diabetes cases.
In the Central Valley, our rates for diabetes are much higher than average, certainly higher than average for California. And also in the Central Valley, we just don't have enough primary care doctors.
The program is designed to help prevent unmanaged diabetes and meet patients earlier in their health journey through outreach and education.
The response has been positive. I think patients appreciate having that extra resource, and the nurse who we're working with to reach out to patients to ensure that they stay on target with their diabetes and with their preventive health care has received very positive reviews from patients so far.
The Diabetes Pilot Program is part of a bigger shift away from what's called fee-for-service toward value-based care. Value-based care is a term used in healthcare that describes a health system designed to focus on the quality of care, provider performance, and the patient's experience.
That's the new kind of measurement to determine how well you're performing as a provider. So hopefully the provider is working with a care team and working the larger health system to make sure that the patient's journey through the health system makes them well. And it's not so much about doing more services, it's about making sure that the overall outcome is much better.
Darren Duncan, Vice President of Value-Based Care Operations at Community Health System, says early results of the program are promising. And if this model works for diabetes, other common chronic conditions could be next.
So right now we're just doing diabetes, but we want to expand it from just diabetes to include other disease states. So we're talking about doing COPD and CHF in the near future, and we're talking about bringing that in 2026.
Darren says for him, the mission behind the program is personal.
My grandmother was born in this area, and she died of a heart attack. And there's certain things I think preventive-wise she could have benefited from having some of these services at her. If she had access to it, I think she'd have better outcomes and maybe not have died such an early age.
But the ultimate goal is to flip the script and turn healthcare into a system that puts patients and their health needs first.
He has a statement called The Cause. And in that, he's like, what if patients come to our health system because they want to become more well? And that's basically the premise. What can we do to make sure that our patients aren't using these higher acuity settings, but they're coming in because I'm actually doing well, I just want some more information about dieting to help me facilitate X, Y, and or Z. Or maybe if I add this particular exercise regimen, it can make me have a better experience as well. If we can improve your quality of health over time, that is the ultimate goal.